let me then tell you what I'm going to do, which is try to give you a bit of a roadmap. It is based on our paper, but I think it will also hopefully set up the more detailed conversations to come. So let me start with a few concepts and numbers, just so we are all on the same page. If there were 100 pregnancies, about 55 of them would be intended and about 45 would be unintended or unplanned. What do we mean by unintended or unplanned? We mean that the woman herself said that she did not want to have a baby or didn't want to have it right now. And this is based on national data, and it's a survey that's been conducted many times. Of the 45 that are unintended, some will be aborted, some will be carried to term, and in the end, we have about a third of all children in the United States right now who are either unwanted or mistimed. So why does all of this matter? Well, I think you've already heard why from the governor. The governor, I think that this is not just a triple win, it's a home run. This is going to be better for children, better for adults. We're going to have healthier babies, happier moms, and better life outcomes for both children and their parents. We're also going to see far fewer abortions, and we're also in the process going to reduce government costs. So, what's the good news here? The good news is that unintended pregnancy rates are falling and have been for quite a while. Now, there's a lag in the data, but as far as we know, they're still going down. Why are they going down? Well, there's no smoking gun that I can point to in the literature, but as an economist, I'm going to frame it as there's a demand-side story and there's a supply-side story. On the demand side, new roles for women as workers and as breadwinners really means that the need and desire to control your childbearing is higher than ever. And on the supply side, we do have better access and more effective forms of contraception than ever. So here's a little data. On the right-hand side is the shift in attitudes. These shifts have been really dramatic in attitudes about women's roles. Given my age, I can remember what things were like in the 50s and 60s, and believe me, it was very, very different. I have to keep explaining this to my younger colleagues because they don't recognize what a huge transformation this has been in women's lives, all to the good as far as I'm concerned. And one of the effects has been that people's desired family size or intended family size has dropped a lot. On the left-hand side are just a few well-known statistics on how women's lives have actually changed. They're obviously working a lot more. They're going to get a lot more education because they know they're going to need to have careers. And most importantly, I think, is that top number there, that 41% of breadwinners now are primary breadwinners, either sole or primary breadwinners are women. So, you know, women have huge family responsibilities nowadays that they didn't used to have. On the supply side, we do have more access to contraception than in the past. Some of you, again, who may not remember what it was like in the 60s, it wasn't even legal to buy a contraception, to buy birth control back then. We had to have a Supreme Court case about that. Everybody knows about Roe v. Wade, but they don't know about Griswold versus Connecticut. So this shows that there has been some shifts over time. And I think the most important story here, or the most interesting one, is that you can see that there has been a big increase recently in LARCs. What are LARCs? They are long-acting reversible contraceptives, mainly the IUD that the governor already spoke about, and also implants. There's been some substitution away from sterilization, especially amongst older women, and away from condoms and the pill amongst younger women. Now, why does that substitution matter? Well, I think this chart tells you a lot. This is telling you that if you have been sexually active for 5 years, which most young people in their late teens and 20s will have been long before they are settled in the job market or have a steady partner, that your probability of getting pregnant if you use the condoms is 63%. On the pill, it's about 38%. And on an IUD, it's less than 4%. Now, that's not because condoms and pills aren't effective when they're carefully and consistently used. But the problem is that we're not all perfect. We forget to take our pills. We forget to get our prescription refilled. We don't always use condoms the way they're supposed to be used. So there's user failure, and with a IUD, you set it and forget it, and you don't have to worry about user failure. Certainly would emphasize, as has already been said, that we should give women the full range of choices. But they do need to know what all of their options are and how they differ. I have had young scholars here at Brookings come up to me in the cafeteria or in the elevator after they read my book that came out a few years ago called Generation Unbound, saying, "Oh my God, I never knew." And these are young women with master's degrees and PhDs. So what's the bad news? The bad news is that these newer approaches are under attack or threat right now, not just newer approaches, but the Title X program, which provides funding for clinics that serve low-income women. And also the provision in the Affordable Care Act that we call the contraceptive mandate sometimes, that's also under attack. So this is going to be particularly troublesome for low-income women and women of color. They're the most likely, by the way, to say that they don't want a child or don't want one right now, and the least likely to have access, especially to more expensive forms of birth control. Keep in mind that a LARC can cost $500 to $1,000, and what 22-year-old has $1,000 to spend up front on a LARC? We have also that the fact that there's not enough information out there. And what you're going to hear about today is efforts to get more information out, as in Delaware, and too many providers that are not trained or not well equipped to provide all the various forms of birth control. And then we have the political issues, which you've already recognized in your questions. So some states are really showing the way here. And, you know, I really want to congratulate Delaware and my friends at Upstream. Mark Edwards, I think, was the first one who came to me and said, "Oh my God, I never knew how powerful this approach could be for improving opportunity." He had been the executive director of a national organization. This mission was to improve opportunity in America. And he looked at all the data and all of the evidence and experience, and he said, this is a much better way, or at least an important way, not the only way, as the governor said, to work on the providing social services of various kinds as well. But this he felt, oh, I think I lost my charts. Anybody know how to get them back? Oh, there, okay. So this is just a summary. You're going to hear a lot more about this, of what some of these states are doing, training providers, offering patient-centered counseling and information, providing same-day access. So you've already heard from the governor how important that is. Screening for pregnancy intentions. That doesn't mean just in the family planning clinic. That means whenever you go to a doctor, including, your general practitioner for your annual checkup, he or she asks you, well, do you want to have, if you're of reproductive age, do you want to have a baby in the next year? If yes, we're going to help you get good preconception counseling. If no, we're going to talk to you about birth control. Offering all FDA-approved methods, which includes all of the stuff I showed you a moment ago, and sometimes these states are also subsidizing costs, which can be very important. Now, you're going to hear a lot more about the research on whether these approaches at the state level have been effective or not later on. I just want to show you this one study because I think it's so interesting and impressive. This was a randomized controlled trial, the gold standard, as my friend Ron Haskins would say, of evidence-based policymaking. And it was in 40 clinics in 15 states around the country. And all they did in the treatment group was offer provider training. They didn't even subsidize the costs. And as you can see, it had a big impact on the take-up of LARCs, and it halved the pregnancy rate at the end of year 1. So, and this is an RCT. This is a little descriptive data that we put together on 2 states, Colorado and Delaware. As the governor said, this all began in Colorado, but it's being imitated in many other states now. And I think what we're all hoping, at least I'm hoping, is it's going to spread, and every state is going to find their way of doing this well, right for their audience. So let me conclude. Unintended pregnancies are declining, but access to the clinics, especially amongst lower income women, and access to the most effective forms of birth control are now being challenged at the federal level. We need to keep in mind that unintended pregnancies are the primary driver of abortions. If we could imagine the following thought experiment, if we could eliminate all unintended pregnancies, granted that's just a aspiration, we would basically eliminate virtually all abortions. Instead, where we seem to be headed is towards a movement to outlaw abortion. If we outlaw abortion, we will still have unwanted and mistimed children, and we'll have even more of them than we have now. So which would you rather do? I understand this is a very fraught issue, but I do think that it's important to keep not just women's reproductive rights in view here, as important as they are, but the well-being of children and families. So we have some challenges still, and I'm sure we're going to talk about them in the upcoming panels. And I really, really look forward to hearing all of that discussion. I think we really have a chance now to dig in. So thank you all very much for listening. Any questions, comments? Yes.
You said that Title 10 is under attack. Do you think you could go into detail? Sure. You said Title 10 is under attack.
Yeah.
Do you think you could go into detail about who and how they are attacking this and how it's going to be?
Well, the funding for the program is, part of their usual congressional appropriation, and in the process of trying to cut back spending, government spending, it's been on the chopping block, but there have been court cases about all of this and efforts to maintain the spending and the program. The person who is here, who knows more about this than anyone in the world, is Andrea Kane or Jenny Ehrlich. Does one of you want to say a word about that?
Until actually this year, when the House just passed a bill that increased the program for the first time in many years. But I think more difficult is the fact that the administration has actually changed some of the grant requirements and is for the first time actually sending money to organizations that actually don't believe in modern birth control. And also adding restrictions and limits, saying you can't send money to, Title X money can't go to organizations that also provide abortion, although they have never provided abortion with the Title X money. So that's just at a very simple level, a number of both legislative and executive level attacks. Those are all pending in court as we speak, although there was a very disappointing ruling from the Ninth Circuit just late last week that would allow some of these very disturbing things that are called the domestic gag rule to go into effect immediately, although they will continue to be challenged. So access to family planning through Title X is under attack as we speak, with potentially devastating consequences for millions of women.
This story changes, basically every, week or two because there are so many challenges in court cases. Can't keep up with it. Anyone else? Okay, well, thank you very much. And will the first panel please come up?
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.